What Medicare Part D plan are you going to enroll in for 2026? The Medicare AEP is starting October 15th. It runs through December 7th, and that's when you make the decision for the next calendar year. Because of some of the changes that have been going on with the Part D program, some people may find themselves without help in how to switch a plan or what plan they should choose. So I'm going to walk you through what it looks like on Medicare.gov. It's a great tool and you'll be able to do a proper enrollment and choose the right plan if you follow these steps. You're gonna go to your computer or your phone, whatever, and type in Medicare.gov. That's Medicare's official website. You're going to arrive at this page, and once you get there, you are going to scroll down a little bit and you're going to see right here that you can choose Find Health and Drug Plans. So you're going to do that. Some of you may have a login. If you do that, if you have one, log in because it will have your information. So click on this. Then the next thing that you're going to do is you're going to put in your zip code and choose your county, and then you're going to hit continue. Once you hit continue, what is it you're trying to do? What kind of plan? You're going to click on Medicare Part D, drug plan, and you're going to hit Find Plans. When you hit Find Plans, they want to know, do you get extra help with your medications? In this example, I clicked I don't get help, and I hit continue. Then you're going to want to enter your medications. So what I'm doing here is I just chose 3 random medications that I see a lot of people on. And we're going to put in the information. We're going to start with atorvastatin calcium. And we'll put in that. You look for it in the list. You're going to hit add drug. And then you're going to make sure the dosage and the frequency is in there properly. The next one we're going to type in is going to be Eliquis. It's a drug we see often that's expensive under the Medicare program. Go in, check the dosage. In this example, I changed the dosage and added the drug. Next one we're going to add is a drug called montelukast. It's a common allergy medication. Again, add it. And obviously your list is going to look totally different. I'm just making this up. So the next thing that you do is you do done adding drugs, and then you're going to add some pharmacies. When you are getting your medications, you want to have a preferred pharmacy because that's where you're going to get the best pricing. So you can elect several different pharmacies, and then we'll see what matches best with the plan where your drugs are going to be the most cost effective. So once you've loaded that, now they're going to show you the different drug plan options. This section right here is important. You want to choose lowest drug and overall cost versus just one specific, because then you get information on the total cost. Like you can see there, 5, 12, 40. As you keep scrolling down, it gets more and more expensive. So you're typically going to land on the first plan, the plan that's up top. So then you're going to want to look into the specifics. Now, this example only shows you October, November, December. The new plans come out October 1st, and that's when you should go in here and look at the plans, and you're going to get all the data on the plan, the monthly costs, deductibles, etc. by clicking on that, find out about plans. You can see all those pharmacies are preferred with this plan because they're in green and it says preferred. So the point being is that you're going to look at the plan, you're going to have an understanding, then you're going to go back and you're going to hit enroll. And then you just follow the prompts, and you are going to have to choose what's the basis for enrollment. I clicked here new to Medicare, but during the AEP, there's going to be a section that says the Medicare AEP, and that is going to be the basis for your enrollment. If this is your first time, or you're already on Medicare and you're enrolling. So follow this, it will be helpful, and then enroll.